What if I told you that the testosterone ranges you've heard are normal, might not actually be normal for your body? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I want to unpack what testosterone levels really mean, why they differ, and how they influence things like strength, mood, fertility, and bone health. If you've ever looked at your lab results and wondered whether your levels are truly right for you, this will help. I've seen so many men walk into my office stressed, confused, even upset. They get their lab panel back and it shows a total testosterone of 310 ngdl, and their doctor shrugs and says, "That's within normal limits." But here's the problem: they don't feel normal. They're tired, their libido is low, mood is off, recovery is slow, and there's a real scientific reason for that. Current guidelines are, honestly, a bit too generalized. The American Urological Association treats 300 ngdl as the lower edge of normal, whereas European guidelines push that lower limit up to 350 ngdl. But the real issue is this: testosterone isn't a one-size-fits-all hormone. Different systems in the body require different testosterone concentrations to run at their best. Take the Testosterone for Diabetes mellitus trial, published in The Lancet. In that study, participants with levels below 440 ngdl were started on replacement therapy. The results: they saw a remarkable decrease in their risk of developing type 2 diabetes. Even more compelling follow-ups on those patients showed improvements in bone architecture and density. That implies that your bones may require higher testosterone levels than, say, sexual function or mood. Speaking of sexual health, you might notice improvements in drive or emotional well-being fairly soon after starting therapy. Those changes sometimes happen in weeks, but visible improvements in lean muscle mass or bone strength, those take longer and usually require sustained, higher levels of testosterone over time. And this brings us to age. Should a threshold of 300 ngdl be considered acceptable for a 25-year-old man? Realistically, probably not. Younger men often need higher circulating testosterone levels to support metabolism, fertility, and long-term health. Many experts now argue for adjusted testosterone ranges instead of a universal cutoff. Finally, when we talk about fertility, reproductive specialists typically aim for levels between 600 to 800 ngdl. That's well above what many labs define as normal. Those higher levels support healthier sperm production and better reproductive outcomes. I've actually made another video where I go into age-based testosterone ranges in more detail, so feel free to check that out if you want a deeper dive. Now let's talk about sleep, which I've emphasized before, because it plays a massive role in testosterone production. Even if your blood test shows you're within normal range, simply improving the quality of your sleep can boost your natural testosterone levels significantly. The majority of testosterone is produced while you're in deep, restorative sleep, following your internal circadian rhythm. If your sleep is disrupted or insufficient, you're essentially working against your own biology. No medication or therapy can fully correct hormonal levels if your sleep is chronically poor. So what's the bigger message? Your testosterone status should never be determined by a single lab value alone. It should be assessed based on your personal health goals, whether that's strong bones, energy and mood, fertility, or overall well-being. Let me also clarify an important point. If your priority right now is fertility, you should not use testosterone replacement therapy. It actually suppresses your natural sperm production. But the good news is, there are other medical options that can enhance fertility without lowering testosterone. I've discussed those approaches in previous content, and to be absolutely clear, testosterone isn't a magical cure-all. If your levels are already appropriate for your body, adding more testosterone won't improve bone strength, won't increase libido, and definitely won't boost mood or fertility. In some cases, it can even have the opposite effect. That said, I strongly believe that individualized hormonal care is where medicine is headed. When we identify the optimal testosterone level for your specific physiology, we can do a much better job at preventing future issues like bone loss, muscle decline, metabolic problems, and chronic health risks. If this discussion helped you better understand how testosterone works in your body, make sure to subscribe. I share new insights on men's health every week, including the topics most doctors don't usually talk about openly. And if you know someone who might benefit from this information, pass it along to them. And as always, take care of yourself. Your health truly matters.